Hi, my name is Marcia, and I'm a student at Florida State College at Jacksonville. Today I'll be doing a quick presentation on workplace injuries. The specific workplace injury that we'll be talking about today is going to be related to the back. The reason why I chose this particular area to cover is just because, as a nurse, you often hear, I want to protect my back. I want to make sure that I do whatever I can to protect my back because, as a nurse, it is your livelihood. It's the thing that's going to keep you working the longest. If your joints, your back, your health is in order, you can do your job for a longer period of time. So because of this, I wanted to sort of tackle this topic and sort of make this topic sort of relatable to all nurses. So I'm going to take you through a scenario of a young lady named Kim, and we'll follow her through this journey in different scenarios related to her back. So let's get right into it. So here we have Kim. She's 22 years old. She works full-time as a mail sorter at USPS, the United States Postal Service. And she's currently in school as well, pursuing her nursing degree. She came to see her primary care physician. Her chief complaint was she was having some lower back pain. She describes it as a 4 out of 10 pain on a scale from 0 to 10, and she says the pain is a sharp pain, and it started a couple of weeks ago. And she says she mostly notices this pain and stiffness after she's worked a long work week. They took her vital signs immediately, and her vital signs seem pretty stable, except she's got a little bit of a borderline hypertension here. Blood pressure is 135/74. That's a little bit concerning, but given her age and the fact that she is in pain, that's something that possibly is okay. So we want to sort of look into her history and see if that's something that we need to sort of look into further. Let's dive into the patient's history. So as you can see, she's got a history of asthma, migraines. She's a smoker, and these are things that can affect your blood pressure. Also, she got a family history of hypertension, diabetes, heart disease. So that hypertension, diabetes, and heart disease, those things are kind of concerning as far as her blood pressure is concerned. But her main complaint is pain. And let's talk about, before we go into getting orders for this patient, let's go to our nursing 101 and let's talk about the pathophysiology of pain. So pain basically has to do with, everybody experiences pain different because everybody has a different threshold for pain. In order for you to even feel pain or acknowledge pain, it has to surpass what your threshold can handle. Afferent fibers basically conduct the pain impulses. They're sent to your muscles through the efferent impulses, and basically this is like an impulse sent to your muscles, and basically you have an involuntary response, and it basically sort of moves your body out of the way of the source of pain. There are two different types of pain as well. Acute pain is usually described as a sudden, sharp, localized pain, and is related to either thermal or physical stimuli. Chronic pain is more diffuse. It's dull pain. People may describe it as burning, achy pain, and it can be related to a physical situation as well, or thermal, or it can be related to a chemical stimuli. So let's do our assessment. Now that we know a little bit about, the pathophysiology of pain, and we know a little bit about Kim's situation and her history, what should we assess with this patient? Now, the two questions I would have is what questions do we want to ask him? We know a little bit about her pain and her symptoms, but I want you to sort of think of some things that you would want to ask him as her healthcare provider. Also, what orders does she require? So, my orders would be basically a physical exam. We want to make sure that, according to the FDA, we want to make sure we eliminate as much imaging as possible, especially if somebody comes in with nonspecific low back pain. They don't want to do too many x-rays and things like that. They don't have to unless they feel like the physical exam warrants it. So we want to do a physical exam on the patient first. We also want to, because this patient has a family history of hypertension and does have a little bit of borderline blood pressure issue going on right now. We want to go ahead and make sure that this back pain is not related to, kidney function. So we want to go ahead and do a BMP and sort of check her electrolytes out, check out her kidney function, and make sure everything's okay there, because it may not be muscular at all. It could just be this patient, she's young, she may be dehydrated, her blood pressure may in fact be an issue and can be causing some kidney problems, and so we want to just sort of look into this further. So we got our results back, and the patient's electrolytes are within normal limits. That's excellent. Kidney function is fine. The physical exam did show it was basically largely uncomplicated. She had some mild tenderness, but she was able to, exert herself with full range of motion. No major issues here. So let's think about what orders we would want to give this particular patient. What is her diagnosis? What do you think we would diagnose her as? Knowing her physical exam was pretty much intact, knowing that, her history and all the labs came back pretty good. What would you diagnose this patient with? And what treatments would you give this patient? So I decided to just diagnose this patient with acute back pain. I'm going to prescribe her some NSAIDs, probably some ibuprofen, Advil, something like that. And I'm going to try to make sure she gets to be seen by an occupational therapist. These occupational therapists will be able to, educate this patient, tell her about some practices, sort of, inquire about her work history and what kind of work she does. She is a mail sorter at the United States Postal Service, and this patient could be doing a lot of heavy lifting and things like that, and the occupational therapist will be able to give her some ergonomic practice suggestions that will sort of help her make her job a lot easier, help her be able to use more core strength in order to protect her back a lot more. And this is the time when we can sort of educate the patient on about how exercise and things can sort of help prevent a lot of this back pain, so that she's not using so much of her back muscles so much, and she's actually using more core strength. So this is basically give the patient a little medication, light medication, and mostly just give her mostly education to help prevent any further damage. So the next time we see little Kim, she is 32 years old now. She's been nursing for 8 years. She graduated and been nursing for 8 years, and she's working on the med-surg unit. Now, she's come back in again with complaints of severe back pain this time and weakness. She says her pain is about an 8 out of 10, and she describes the pain as being like achy. And she says it's worsened over the past, month or so. Her blood pressures look like they've gone up some. Her blood pressure is 143/94. Everything else looks pretty good. She's currently still taking ibuprofen because I guess her back pain has been a chronic issue with her, and she's taking Clozar for hypertension. And we may, as nurses, want to make sure that that medication is actually helping. We want to titrate that one as well, because her blood pressure issues now. But she's at a severe pain level. Her pain is like at an 8 out of 10. So this could be again attributed to just her pain being uncontrolled, and that could be causing the issue with her blood pressure. So let's look at her history. We sort of know a little bit about Kim's histories, but in her early 20s, she had the chronic back pain. She was non-compliant with her OT and physical therapy. She's a smoker. She still smokes. She's up to a pack a day now. And she's got hypertension now, and she's now a mother. She's a mother of 1. So what are some questions we want to ask this particular patient, or what are some things that are going through our mind about this particular patient? So Kim's job. How can her job affect her, back? We're all nurses. If you haven't worked in med-surg, I know you heard about it, or, done your rotation in med-surg. And, it can be a very busy place to work. It does require lifting of patients and things like that. So we sort of want to, think about, what kind of, constraints her job may have and how that may affect her back. But what other problems could cause Kim's symptoms? Now, Kim, is a smoker. She works a high stress job. These are things that can also have an effect on your muscles, have an effect on circulation, and that can affect your back. Also, we need to sort of find out why was Kim non-compliant with her therapy. And then we want to find out what kind of orders we want to have for Miss Kim. So let's see what kind of lab tests we want to order. So we want to order an x-ray in this case. This is a more severe pain. It's not just a little bit of pain. It's achy now. So it looks like it's more of a chronic condition. We want to make sure everything's okay. So we want to get some imaging done with her. We want to do an MRI as well, just to sort of see the fleshy part, not just bone, with the x-ray. We also want to do cardiac enzymes. This patient's blood pressure is elevated. She's hypertensive. And sometimes if a woman is having a heart attack or any kind of cardiac issues, she may not necessarily have chest pain like we see in a lot of male patients, but women can have hip pain, back pain, and that could be related to a cardiac issue. So we want to do EKG, we want to do cardiac enzymes, make sure everything is okay there. And then we also want to do another basic metabolic panel. She's got hypertension now. She's at high risk for kidney problems because of that, and so we want to go ahead and throw that test in there. And it's always an issue with electrolytes when somebody is young. She's a woman, taking blood pressure medication and things like that. We want to make sure that her electrolytes, kidney function, and everything is all stable. So let's get right into it. Let's see the results. So the EKG, cardiac enzyme, this is basic metabolic panel, all that came back very good. Her x-ray was within normal limits, but the MRI showed some inflammation and some mild muscle damage. So in this incident, what do we do? Now, I sort of gave her a diagnosis of repetitive strain injury. This is something that is serious. It's a serious warning sign, and it's a serious thing that we need to discuss with Kim. She has to change her current practices. She has to be compliant with the physical therapy, or this could get worse. So we want to make sure that she gets physical therapy. We want to make sure that she applies cold and heat to her back. And we also want to make sure she stays on her ibuprofen, her medications and things like that, her anti-inflammatories. But we also want to make sure that she gets to see an orthopedic doctor as well, and have them on board. So in the scenario 3, we see Miss Kim. She is a more mature nurse now. She's 56 years old, and now she is the nurse manager on her unit. She's postmenopausal. She still smokes, did not stop that habit. She smokes 2 packs per day, and her chief complaint right now is back pain, weakness, and she's unable to really stand straight up. Her vital signs, they're stable. Looks like the blood pressure is a little under control now. She's takes Premarin, she's taking Norvasc for her blood pressure, she's taking hydrochlorothiazide, and she's taking meloxicam, and that's just for the swelling and things for her, previous back injuries, previous back pain. So let's look at her history. And as I mentioned before, we already know a lot of Kim's history. We've been following her since she was 22. So let's go into her history. Now she's a mother of 2. She's got COPD. She's a smoker, so that's related to that. Obesity. She's a little bit older woman. She's got a history of these, hypertension, diabetes in her family. But she may have a little history of obesity. Chronic back pain. We already know about that in her history, and then hypertension. Now let's talk about her assessment. So what diseases in Kim's history could have contributed to her back her back issues? So this is a person who is postmenopausal. So her body's not giving off that estrogen. So a lot of times when you are postmenopausal, you lose a lot of muscle strength that will break down those core muscles. She was already having back problems to begin with, but when you're postmenopausal, you lose more muscle strength, so you lose more of that core strength, and you put more strain on your back and on your muscles. Now she's also a smoker. Smoking not only cuts off the circulation, but it makes your bone density a lot worse, and so does being postmenopausal. Takes away a lot of that calcium and things like that from your bones. So that can also break down the the bone density. So let's think about what kind of test should be ordered based on just knowing her history and things like that. And what would her final diagnosis be? So for this patient, we decided to order an x-ray. Of course, we want to do another MRI. We haven't seen one since she's been in her 30s. We want to do a bone density test at this time because she's postmenopausal. She's a smoker, so she has habits that would contribute to breaking down of her calcium, and we want to basically go ahead and check her calcium level as well. So her bone density score is the T-score was 2.75. That's pretty high. Well, actually pretty low. And her calcium level is 3.0. That's low as well. Her x-ray showed degenerative changes in her lumbar spine. Her MRI showed some herniated discs, some inflammation, and multiple muscle tears. So what is her diagnosis? Her final diagnosis is degenerative disc disease and osteoporosis. Her treatment is going to be basically, we're going to give her calcium supplements to try to supplement all this calcium loss, but we also want to make sure that she considers surgery, because this is not something that you just, she can continue to take ibuprofen and NSAIDs and things like that and these will help. She's, it's more advanced, and she actually has muscle damage. She actually has degenerative changes in her spine, so she's going to need some surgery. So I want to thank you all for listening to this presentation and going through these different scenarios with me. This was very fun to do, following one nurse throughout her entire career and seeing how, non-compliance, lifestyle choices, and all of that, and job-related issues can affect your back health. I hope this was helpful, and I want to thank everybody who listened, and have a great day.